Today, we're talking about transport options for people with disabilities and older adults with Jane Mahoney, a training and technical assistance specialist for the National Aging and Disability Transportation Center.
My name's Jane Mahoney, and I work for the National Aging and Disability Transportation Center. Prior to this job, I worked at our state area agency on aging, and I took care of managed the family caregiver support programs and just really loved working with family caregivers and people who are supporting them. And I moved into this space with kind of a little hope that I could keep working on caregiver support, but tying transportation in it. And transportation's just part of everything we do. And I just think that in the years that I worked with family caregiver support, we did not talk enough about transportation and how transportation could be a real good support for caregivers and even a form of respite. So I'm excited to talk to you about it today.
Yeah, we're excited to have you. Thank you for agreeing to talk with us. Maybe we can start getting into the topic by having you tell us a little bit about what types of transportation are available in communities, particularly for people with disabilities and older adults.
So community transportation programs really can be found in pretty much every community. However, each community is really unique in what it offers. So in more urban areas, you're going to find like buses and trains that run along that fixed route. And the public transit agency who runs that service will also provide ADA paratransit service for people who are unable to use the bus or train independently. So ADA is Americans with Disabilities Act. So you're really definitely going to want to check that out if you have caring for someone who can't use the rail or the bus independently, because they could apply for paratransit. A lot of communities have volunteer driver programs, and that can also be an option for older adults or people with disabilities. And these are people who volunteer to drive using either an agency vehicle or sometimes their own vehicle and give rides to people who need them. Typically, you're going to need to make those reservations to do that in advance, a day or maybe a week even. It depends on the program. And then there's also other programs that operate what we call on-demand services, where you call to schedule a ride. Usually they're going to be given with wheelchair accessible vehicles with drivers who are trained to, provide that service and take people to medical appointments, or sometimes, they can go anywhere. Some programs have limitations as to where they're going to take people. So those are things that you can check when you're looking up this information. And then finally, a sort of a newer kind of program that's becoming more and more popular is what we call on-demand programs, where you don't have to call in advance to get your ride. You just need a ride, and you can just contact the agency frequently through an app or a phone number and just like, hey, I'm ready to get picked up and I need to go to the grocery store. And so those are becoming very popular for obvious reasons because they're very easy to use. So usually those are going to be within a certain geographical perimeter, but they are becoming more common.
That's awesome. I guess maybe this is just a selfish question, but I know there's different programs. Every state is going to be different. Every community is going to be different. And we're talking about transportation for older adults or people with disabilities. Are there general eligibility criteria for this? And I say it's selfish. My leg is broken right now, so I don't have a permanent disability, but I do have a hard time getting around. So I guess my question is for myself, but also for anyone listening, where does it start and end on who might be eligible for disability transport services?
Yeah, that's a great question. For paratransit, you don't need to have a certain disability. You just have to show that you are unable to utilize the service independently. So there's an application for that and some criteria. And again, there's some differences depending on the community. Same for some of the other community transportation options. Sometimes they have eligibility criteria. Like I mentioned, possibly they could say we can only take you to a medical appointment, or there might be an age limit. Like some of the funding sources might be just for older adults, and so there might be an age limit. So that really depends on the agency and where that funding is coming from usually. So those are good questions to ask when you're inquiring about getting a ride.
Awesome. Yeah, that makes a lot of sense. What are some common barriers that people or their families might encounter when trying to access disability transport?
Yeah, I think honestly, the first barrier is that people don't know what's available and don't think about the fact that, maybe I don't have to take my mom to the hairdresser, maybe there's something that a ride that she could get. I'm going to use that selfishly as my example because my mom liked to get her hair done every week, and I just couldn't do that. I just can't make that happen. But just it's remembering that, there might be something out there. So I think first barrier is not knowing what's available. And until you need something, you often don't know what's out there. Other barriers, I know caregivers are very protective of their loved ones, and they may feel like it won't be safe, that the driver won't know how to handle it, or they're going to get extra help and won't be able to do it on their own. And so that can be a barrier. Of course, barriers such as limitations to, like, here's a great transportation agency, but they can only take them to a medical appointment. And I need a ride to the hairdresser. So some of those things. Cost can be a barrier, although there are a lot of programs out there, depending on the service you're looking for, that can be really affordable, or that there's like voucher programs. The safety, and those are like kind of some of the main things, or a restriction on how far you can go. I know some agencies use county-based funding, and so if you want to go across county lines, in some areas that can be an issue. So some of those things. And as you get into some really rural areas, the availability of options is going to be limited. So
yeah, that all makes sense. And something we have talked about offline a little bit is about like another barrier of people maybe not knowing how to access this or use public transit, et cetera. Like, are there additional programs that support people in using public transit, or some of these additional programs?
Yes, and I'm so glad you asked that, because that is another thing people aren't aware of, is that there are other programs out there that can help someone who maybe can't do it on their own right away. But travel training is something that we really like to see. And that can be, it could be a class, like a group class. It can be a one-on-one instruction. It can be somebody riding along for a while, often provided with like a fixed route. Here's how you ride the bus. Here's how you transfer. Here's how you pay. Here's how you schedule your ride, that kind of thing. But it can also come with some of the smaller programs, like the on-demand one, where you might have to use an app. And, sometimes people aren't familiar with how to use an app. So they'll have a little training and they'll show you how to do it. So travel training is definitely a great tool. Some programs use something called volunteer chaperones, where it's not a volunteer driver, but someone that would ride along with the person, assist them in getting on and off the vehicle, and maybe stay with them through like a medical appointment. So they are not alone, and that really addresses that safety issue. So that's neat. Also, being aware that transportation providers offer different levels of service, we call them. So like a fixed route, a train or bus is called curb to curb, because they'll pick you up at the curb and they drop you off at the curb. But some of the other programs have what we call door-to-door assistance. So the driver would actually come to the door and help you get from your door into the vehicle, and then out of the vehicle into the door of the clinic or of a grocery store or whatever. And then there's yet another level of service that is called door through door, where the driver actually can go into the home and help people get from inside their home and then into the doctor's office or wherever they're going. Less common, but also hugely helpful for people with disabilities or older adults who just need a little more help. So when you're looking for ideas for transportation, just really ask about the different kinds of service and different types of assistance that can occur.
I think what's coming up for me is there's so many options available. Some of these I didn't know about. I didn't know about these different sort of tiers of service. I guess people's biggest question is like, how do they know what's available to them? Are there like concierge services that can help them? Who do they call to like figure out what is available to them? And then another layer to that question is, you talked about some complexities, like if you need to go across state lines or a program has limitations, like is there someone people can work with or resources they can access to know how to like puzzle piece together what they need?
That's a huge help. There are people called mobility managers that can be hired, and they're not everywhere, but something to inquire about. And their job is just that. It's to kind of keep an inventory of all of the different transportation options that are available. And they can sit down and work with you and help you figure out, like, what do you need to go? Where do you need to go? When do you need it? Is this something that recurs, or is it just a one-time thing? And then they can really help you figure that all out. And they would ask those kinds of questions. What kind of trip is it? Do you need to get to the doctor or to a car, like a social thing? And how much help do you need? Do you have a mobility device? Do you have a walker, or do you have a wheelchair or oxygen tank? what time of day do you need to get where you're going? And they can kind of work through all of that for you. So if you can find a mobility manager in your area, you're in really good shape because that's really their job. Otherwise, the transportation providers usually know about the other, they'll know about their own service, but they would probably be able to also point you to other services in that area. And if you don't even know where to start, well, some common places are human services agencies would typically know where these things are. If you're looking for someone for older adult, transportation, senior center, or an area agency on aging or an aging office should be able to point you in the right direction. Independent living centers also should have that kind of information. And if you need to back up even farther than that, like I don't even know where those places are, there is a really great resource called the Elder Care Locator. And it's a phone number. They're also online, and they really can get you connected to your local resources. And whether you are an older adult, it's called Elder Care Locator. They will also assist you, even if you are just someone with a disability or you're a caregiver, that can be a really great place to start looking for the answers to some of these questions about where to find this transportation.
Yeah, that's perfect. And we'll be sure to link Elder Care Locator here so that people know where to access. That's a great resource. You mentioned that cost can be a barrier for people accessing transport. Can you talk a little bit about, I know this varies by program and community, et cetera, but generally speaking, are these services covered by Medicaid or other government programs, and or are there other funding options to cover transportation costs?
I had mentioned non-emergency medical transportation and Medicaid. For people who are on Medicaid or medical assistance, there is coverage to travel to and from medical services. And of course, all the little fine details, are going to depend on what state you're in. But in general, yes, if you're on Medicaid, there is transportation covered to get to medical appointments. Medicare, the insurance for people 65 and older, only really covers emergency medical transportation, so an ambulance. However, some Medicare you can get through Medicare Advantage plans. And so if you happen to have a Medicare Advantage plan, you should check to see if they cover transportation. Sometimes they will cover some types of non-emergency medical transportation as well. Other than Medicare and Medicaid, sometimes there are voucher programs through the senior center or through the independent living center. And sometimes there's discounted rides for older adults, people with disabilities. It really, really depends, but it's definitely a valid question to ask when you're looking for transportation. And then one other little tidbit is with the fixed route, the rail or the bus, if you are an older adult or a person with a disability, you do get half fare during non-peak hours. So half or reduced fare during non-peak hours to use the fixed route. So
that's a good tip. Again, I know this varies, program, community, et cetera, but if someone isn't eligible for Medicaid, Medicare vouchers, if they're paying out of pocket, generally speaking, are they paying like a monthly pass or are they paying per ride? And I guess this is a hard question, but I think a question that comes up for people is like, what am I looking at? Is this like $5 a ride or $150 a ride?
It would be not a monthly. I mean, sometimes you can do like a fixed route pass where you get stuff for a month, but in general, you're paying for a one-way trip. I don't know that I could really provide you with a cost. It really just depends on the program. Sometimes it's free, depending on where they're getting their funding source from, or if they're a new program, sometimes they'll do free rides for a while to get it out there. And then it can be, a lot more than that. But I don't even want to throw out an amount because it just varies a lot. And how it'll matter, like a volunteer driver program, it matters how far you're going, how many hours is the driver staying there and waiting and coming back, or, it's just a lot of different things. But it typically is paid for per one-way ride.
Awesome. Yeah, that's helpful. And I hadn't even really considered the variables of how long a person might be staying with you, et cetera. I have a couple more questions for you. This one is about, we mostly are supporting family caregivers who are caring for a loved one in their home. How can a caregiver help arrange transport for their loved one? Like, is there anything that a caregiver needs to think about, or would it be the same as organizing it for themselves?
Well, it'd be similar. I mean, if you if you can find a mobility manager in your area and be able to sit down and, someone described a mobility manager as like a social worker for transportation, because they can really work through all of the different things that you need to think about. Is the person going to the grocery store? And if so, how many bags are allowed to be carried back? And can they carry those bags? Do they have a mobility device? And will the vehicle be able to help them hold that device and get them in and out? Just lots of things like that. If they're doing like a fixed route where they're having to wait for a ride, are they waiting outside in the sun or in the cold? Or is there a covered area? Is there a place for them to sit? Or do they have a walker that they can sit on? There's just a lot of those types of things to kind of consider, how much help that they will need, things like that. And so depending on that program, if it's a transportation program for older adults, people with disabilities, those drivers are trained to work with people with disabilities. They know how to manage wheelchairs and how to manage with mobility devices. They know how to secure them in their vehicles. They learn about communicating with someone, with a disability, who like maybe can't speak or is deaf. So there's a lot of training out there so that drivers are providing good service for people who need rides. And just talking about family caregivers too, I think it's important to remember that a family caregiver could ride along with the person too. So if your loved one has an appointment in a large medical complex and it's, the parking lot is a quarter mile away and you have to do that drop off and then go park and then come back, like there's a lot of that. So sometimes even having a ride that you both go on can be helpful for a family caregiver. It's like, I don't have to think about that. I can just sit with my loved one. If it's a procedure and they're coming back, then they can spend their whole focus on that person instead of thinking about managing traffic and all of that stuff. So that's another thought too. Even if you're like, well, my loved one wouldn't be able to go alone, but you might also benefit just from utilizing some transportation.
Yeah, I think that's a really good point, especially for families that maybe don't have their own transportation or like need to get people around but need extra assistance. Is there anything we've missed about disability transport that I know a big barrier is people don't know what's available to them. So if we use this as a platform to just make sure people know that these options are available to them, is there anything we've missed? Anything else you want to share with our audience?
Maybe just reiterating again that I think caregivers and people who support caregivers, because I know I did when I was doing that work, just don't think that this could really work. Like, I just don't think it's going to work. But I really encourage people to give it a try. We have a tool on our website called the My Transportation Plan tool, because sometimes it's just a matter of getting all that information down. So it's just a simple little form. On one side you can write down the different options that are available in your community. And again, if you have a mobility manager, that will be filled out. Or even if you find the person or the agency that does provide the transportation for people who use wheelchairs and things like that, they probably have some of this information. But if you can kind of get it down, when they're open, how much advance notice do you need to get a ride, what areas they cover, what types of transportation do they provide, kind of get that all on a piece of paper. And then on the back side, the tool has like your own personal needs. So I go to a hairdresser Friday and I have this appointment coming up on Tuesday and I like to go to the grocery store on Wednesdays, whatever. So you kind of like write those things out, and then you can kind of do this comparison and see, is there a volunteer driver program that, goes in this area and could do this trip for me to do the grocery store or whatever. So, and just give it a try. People don't think about it, but if you think about the time that a family caregiver spends dropping off and picking up someone for appointments or for employment or a weekly social activity, it can really save a caregiver a lot of time. So I just encourage people to consider it and give it a try.
Yeah, that's awesome. And our hope is the same. That's why we're talking to you, is that we want to, take some of this burden off of people and let them know what resources are available to them. Thank you so much for joining us. We'll be sure to link everything you've mentioned so people know where these resources are. I really appreciate your time.
Yeah, well, I appreciate you bringing transportation into your caregiver conversation.